Did you know that girls are more likely than boys to get concussions while playing sports? A new study is bringing light to the topic. Dr. Greg Pierce with Patient First is here to answer questions about this stunning report. So the American Academy of Orthopedic Surgeons found that girls are more likely than boys to get concussions. Why?
That's correct. In this study, they compared concussion rates among athletes playing soccer, lacrosse, and football. Now, very few girls played football, so that most of their injuries were from soccer. Now, there's some theories out there about why the girls had a higher rate. Nobody knows for sure. One theory is that the girls have weaker neck muscles, and therefore their heads are less stable when they're either colliding with another player or when they're hitting the soccer ball. Another part of the theory is that girls may be more likely to actually report a head injury than boys are.
So hormones not playing a factor in these findings, as far as we know?
Only in as much as it determines the strength of the neck muscles.
One other question. If a parent thinks that a child has suffered a concussion, what are the signs and symptoms that they should look out for?
Basically, I keep it simple for myself. A head injury with anything else. Headache, nausea, slowed thinking, slow speaking. Most organized sports now have a program where they actually have the children do a pre-injury assessment where they answer questions on a paper. And then if there's been a head injury, they will compare those answers, the answer they give after the injury, to give some formal assessment.
Well, schools will start very soon, and we know that the football players will be out on the practice field very soon. Great information, Dr. Pierce, for all the parents and young people out there. Thank you so much for joining us.
Well, thank you.